what prostate cancer risk factors are higher in Black Americans than in other groups? A risk factor is anything that increases the risk of getting a disease. Some risk factors like smoking can be changed. Others like age or family history cannot be changed. Having a risk factor does not mean that you will get the disease. It just means that it's more important to get screened for it and catch it early. There are dietary factors. It appears that eating a lot of dairy products appears to create a higher chance of getting prostate cancer. Overweight and obesity are more common in the Black community. Some studies have found that obese men have a higher risk of getting more aggressive cancer and also a greater chance of having it advanced and of dying from prostate cancer. Geography is an issue. Prostate cancer is most common in North America, Northwestern Europe, Australia, and the Caribbean islands. It's less common in Asia, Africa, Central America, and South America. Factors like lifestyle differences like diet are likely to play an important role. Asian Americans have overall a lower risk of prostate cancer than white Americans, but Asians living in America have a higher risk than their counterparts living in Asia. There may be a possible link between exposure to Agent Orange, a chemical that was used as an herbicide in the Vietnam War, and family history. Since more Black men are diagnosed with prostate cancer, a Black man is more likely to have a relative with prostate cancer. And if a father or brother has prostate cancer, this more than doubles the man's risk of developing this disease, especially so if it's a brother. The risk is even higher for a man with more than one affected relative, and it's also higher if the relative developed prostate cancer when they were young. Prostate cancer is rare in men younger than 40, but the chance of developing prostate cancer rises rapidly after age 50. About 6 out of 10 cases of prostate cancer are found in men older than 60. There are gene changes. There are genes that are associated with breast cancer, the BRCA genes, BRCA1, BRCA2, and they have found that while they increase the risk of women having breast and ovarian cancers, they also increase the prostate cancer risk in men. Smoking may lead to a small increase in the risk. There are some chemical exposures. They found that some firefighters have been exposed to chemicals that tend to increase the risk. Some people think that inflammation, like if you have prostatitis, may lead to an increased risk of prostate cancer. Sexually transmitted infections, they may have a questionable role. A very interesting study by Dr. James Bennett, who's a prominent urologist here in Atlanta. He looked at the vitamin D levels of his Black prostate cancer patients and found that they were extremely low or non-existent. African Americans with darker skin need more sun to produce vitamin D, which is the sunshine vitamin, as it's so called. In the winter months in North America, nobody gets enough sunlight to produce good levels of vitamin D. The days are short, the sun is less bright, and we're covered with clothing. So I think the vitamin D levels may play a role in the higher rate of prostate cancer among African American men.